Hello, and congratulations for taking the first step on your Medicare journey. If you're joining me today, you're probably turning 65 soon and have a few questions about enrolling in Medicare. I'm Chris Jaffe, the Director of Medicare Education at Advise. Education is really at the heart of what we do. Medicare is complicated. If you don't understand it, it's hard to choose the right plan. We want to help you feel confident about your Medicare knowledge. I'll be presenting today's seminar, and I encourage you to contact us afterwards if you have any questions. We're here to help. Today, I'm going to give you an overview of how Medicare works. I'll also explain how you can find the right plan for your individual healthcare needs and meet your Medicare deadlines. By the end of this seminar, you'll have a better idea of what your Medicare options are, what you need to do as you approach 65, and how to make the best decisions for your healthcare. Before we begin, let's think about your goals for today. Please write down the 3 most important things you hope to learn from today's seminar. I'll give you some time to write them down before we continue. Medicare really is a whole new world of health insurance compared to what you've had in the past. It's a wonderful benefit, and it should be, considering you've been contributing to it all your life. Now it's time to enjoy what you've earned. There are a lot of benefits to Medicare. One big benefit that is different from most health insurance is Medicare has very low or even $0 deductibles for your medical coverage. Imagine being able to go and get the healthcare services you need without having to spend thousands of dollars before your insurance kicks in. But that's just one benefit. There are lots more. Medicare is structured differently than the insurance you're used to. And it's important to understand this so you can begin to see what coverage will be best for you. All medical insurance covers both hospital or inpatient services and medical or outpatient services, such as doctor visits, outpatient surgeries, medical equipment, and therapies. Medicare covers these also, but it is set up as 2 parts, Part A and Part B. Part A covers inpatient services, while Part B covers outpatient services. And together, these are called Original Medicare. Now that's because these were the only 2 parts of Medicare when it was originated back in 1966. You might wonder why Medicare created these parts as separate entities. The answer is that when Medicare was established, it was not intended to cover all medical costs. The government decided to offer Part A for no premium to all beneficiaries who've worked at least 10 years. Part B, on the other hand, is technically optional, and it requires a monthly premium, which is $148.50 in 2021. Now, the vast majority of beneficiaries do opt to take Part B because it covers outpatient services, which are very valuable to most people. And getting inpatient and outpatient coverage for $148.50 a month is still a very reasonable cost. As I mentioned though, Original Medicare does not cover 100% of your healthcare costs. There are costs that you are responsible for, such as deductibles. For example, let's say you have an inpatient stay in the hospital, you're going to pay $1,484 deductible for each benefit period, and then Medicare pays the rest. For any outpatient service, you pay a $203 deductible. Now, after you meet your deductible, you pay 20%, and Medicare covers the remaining 80%. You may be used to having your current health insurance cover something like 80% of your healthcare costs. Realistically, we don't have much choice on employer plans but to accept this level of coverage. You are probably aware, though, our health does tend to decline as we age, so the gaps in coverage for hospital and outpatient coverage can be difficult to manage over time. Also, one of the downsides of Original Medicare is there is no annual limit on your costs. If you use a lot of medical services, these costs can add up quickly and put a big dent in your retirement savings and income. Now, one of the solutions to this problem is Medigap Insurance. It's also known as Medicare Supplement Insurance. These are plans designed to cover the cost gaps in Medicare, which is why they're known as Medigap Plans. They are optional additional insurance policies that you pay for on top of Original Medicare to give you a higher level of coverage. Let's talk a little bit more about these plans. Medigap plans are offered by private insurance companies, but they are regulated by Medicare. Medicare requires these plans to be standardized using the letters A through N. This means if you get a Plan A from one company, it's going to have the exact same benefits as a Plan A from another company, though the premium cost can be different. This was designed to help people not get confused when comparing plans. These plans are also guaranteed issue when you turn 65, and this means there's no underwriting or no questions about your health condition when you join at that time. However, if you have Medicare Part B for 6 months but have not yet enrolled in a Medigap plan, you are subject to medical underwriting. This is a limitation for those whose health grows worse as they age. It can become impossible for some to switch Medigap plans. Another challenge with Medigap plans is their monthly premiums. These can start out as low as $100 per month when you're 65. However, most of them increase as you age. We've seen premiums as high as $400 or more for our older beneficiaries. So, why do some people choose these plans, even when they have such high premiums? Well, they offer low or even no out-of-pocket costs for Medicare-covered services. This can be worthwhile for a select few who use a lot of services, a lot of high-cost services, and that can justify these premiums. Also, these plans are accepted by all doctors who accept Medicare. Medicare does make changes to regulations from time to time. As of January 1st, 2020, Medigap Plan C and F are no longer available to people new to Medicare. Plan C is not as common as Plan F. Now, previously, most people who purchased a Medigap plan enrolled in Plan F because it covers all the gaps in Medicare at 100%. However, Medicare is retiring this plan. They found that plans that cover 100% of all costs lead members to use services unnecessarily, which drives up costs. That's why the two plans that covered all deductibles were made unavailable. However, there are other plans still available. Plan G, for example, is the closest to Plan F, and it still covers very close to 100% of your Medicare costs. And because Medigap pricing is based on individual factors like age, gender, tobacco use, it's really important to review all your options carefully. Many people get a Medigap plan without considering all of their options and what's really the best form of coverage for them. So far, we've discussed hospital and medical coverage options under Medicare. Now it's time to talk about another important part of Medicare, prescription drug coverage, otherwise known as Part D. Again, most of us are used to employer coverage, where prescription coverage is part of the whole package. In Medicare, it's a separate entity from both original Medicare and Medigap. Part D did not come into being until 2006, a full 40 years after original Medicare. So it was an add-on component. Medicare contracts with private insurance companies to offer these plans to you. That means you pay a separate premium for a standalone Part D plan. This averages somewhere around $32 a month. Before choosing a plan, it's really important to make sure it covers the prescriptions you're taking at the best possible cost. As you can see here in this diagram, there are two distinct paths you can follow to receive your Medicare. We've gone over the original Medicare path, which consists of Medicare Part A and Part B. If you take this path, you can also add a Medigap plan for additional coverage at an additional premium cost. Most people on this path also add a Part D prescription drug plan, which has an additional premium. The other path you can take to receive your Medicare is called Medicare Advantage. We're going to go over that one next. Medicare Advantage is called Part C of Medicare. Part C is an alternative way to receive your Medicare. What this means is although you still have all the benefits of Part A and Part B, you receive and pay for them differently. Now, these plans came along after original Medicare. They were created to offer beneficiaries some better benefits while reducing costs. Just like with Part D, Medicare contracts with private insurance companies to offer Medicare Advantage plans. These plans often include Part D prescription drug coverage. This is much more similar to what you're used to with your employer coverage. With Medicare Advantage, you have one card that you use when you receive your healthcare services or pick up medications at the pharmacy. As I mentioned, Medicare Advantage plans offer the same benefits as original Medicare, as well as additional benefits while lowering your costs. They're able to do this because they have the power to negotiate rates within specific HMO and PPO networks offered in the county where you live. We'll talk a little bit about these additional benefits in a minute. A lot of people like the fact that Medicare Advantage plans are usually offered as an all-in-one plan that includes both medical and prescription drug coverage. This is convenient and similar to an employer plan. If you happen to have other prescription coverage, you can get a Medicare Advantage plan without Part D. What's especially nice about Medicare Advantage plans is you can get all of these benefits with a low or even no premium. If you choose Medicare Advantage, you continue to pay your Medicare Part B premium as well as a $0 or low premium for your Medicare Advantage plan, depending on which plan you select. The money you continue to pay for Part B helps Medicare offer these alternative plans at such a low cost. One question we get asked a lot is, how can an insurance company offer a plan with a $0 premium? I know this might sound too good to be true. We've all been around long enough to know nothing is truly free. So the question really is, where does the funding come from that allows these plans to avoid charging members a premium? And the answer to that is simple: Medicare. Medicare pays the health insurance company to administer the plan benefits for each member. Why would they do that? Well, it's cost efficient for Medicare to pay a company to process and coordinate payments and all the things that Medicare has to do for those who are on original Medicare. Now, in this delivery system, the insurance companies are able to cover all Medicare benefits, and they even offer extra benefits and still stay profitable. It's really a win for everyone. And when you realize you've been contributing to your Medicare benefits all your life, it's nice to know how to maximize your return now that you're a beneficiary. Enrollment in Medicare Advantage has steadily been growing over the years. More and more people are discovering the benefits to these plans. The first reason these plans are so popular is their low premium cost. Having to pay large premiums for Medigap is a difficult burden for many Medicare beneficiaries. The second reason is low cost sharing for medical services. This refers to how much you have to pay when you go to the doctor or hospital. Now, if you recall, with original Medicare, you're responsible for 20% of the costs of medical services. With Medicare Advantage plans, you pay fixed copays for these services, like $10 for a doctor visit, for example. This reduces and contains your costs. Now, the third reason that people enjoy Medicare Advantage plans is the extra benefits that they offer. We'll review some of these in just a moment. But last, but definitely not least, is the enhanced level of medical care the members receive in these plans through a dedicated team of providers. We're going to look at each of these factors now, along with a few examples. Medicare Advantage plans offer a number of extra benefits that are not available through original Medicare. Some of them are listed here. Now, these benefits do vary from plan to plan, so it's important to focus on the ones that are important to you. Also, look at the details of the coverage so you know that you're getting what you need. With dental benefits, for example, some plans only cover preventive services like cleaning and exams, while others cover fillings and restorative services. Some plans even cover dentures. Vision often includes exams plus allowance towards either glasses or contacts. Hearing benefits may include discounts on hearing aids. That alone could save you thousands of dollars in the course of a year. Transportation means non-emergency rides to healthcare appointments. Over-the-counter benefits usually come in the form of a monthly or quarterly allowance to purchase drugstore items that you need. This is a great way to reduce costs. Now, fitness benefits most often include a gym membership. Some plans now give members exercise kits to help them stay healthy, especially during these pandemic times. In addition to cost savings and extra benefits, the healthcare delivery model in Medicare Advantage plans really helps support your health. Everyone understands the value of being able to go to a doctor or a specialist you know and trust. However, not everyone is aware of the value of having a network of doctors and health services taking care of you. We like to think and hope that our healthcare is coordinated thanks to advancements in technology and electronic record keeping. However, there are often lapses in communication between providers who are not part of the same network. Now, communication isn't perfect anywhere, but studies have shown having a team of providers who are tracking your health and keeping in touch with you leads to better health outcomes. Medicare Advantage providers will definitely go the extra mile to make sure you get the care you need. Now, to recap, we've gone over the two different paths to Medicare. You can't mix and match these two options. For example, you can't get a Medigap plan if you have a Medicare Advantage plan. They just don't work together. If you go down the original Medicare path, you'll need to add a standalone prescription drug plan. If you go with Medicare Advantage, your prescription coverage will be part of the plan. But no matter the plan or path that you choose, you never lose your Medicare or your rights and protections that go along with it. Now it's time to answer the question I'm sure you're asking yourself. How do I decide which plan is best for me? That's a great question, and the answer isn't the same for everyone. Although there are a lot of options, choosing a plan that best meets your needs comes down to a few factors. You should think about what your plan needs are. Make a list of your doctors and all the prescriptions you take, then take a look at your budget. Determine how much you can afford to pay for healthcare over the course of a year. Choosing a plan that best meets your needs comes down to three key factors. One is cost. Does the plan have a premium, and if so, how much is it? How much will it cost out of pocket to receive healthcare services? Now, both medical and prescription costs are important factors to consider. Lowering the amount you pay for even one expensive prescription can have a big impact on your healthcare costs for the year, for example. The second factor is coverage. You want to ensure the services you need are covered on your plan. And you might want some additional services like dental or vision, as we discussed earlier. The third factor you should consider when choosing a plan is care. This means being able to keep going to the doctors and hospitals you already trust and visit, since this is an essential part of your health. Now let's talk about when and how to get started with Medicare. You do have some choices and decisions to make, and I'll go over those. When you turn 65, you may decide to retire, or you may want to keep working. You may elect to take your Social Security benefits, or you might delay receiving them for several years or more. Each of these scenarios impacts when and how you might want to receive your Medicare benefits. If you're planning to leave work around the time you turn 65, there are a few things to keep in mind with respect to Medicare. If you elect to receive your Social Security benefits when you turn 65, you'll be automatically enrolled in Medicare and receive your Medicare card before the first day of your birth month. Social Security actually initiates enrollment in Medicare. Now, if you choose to postpone your Social Security benefits until later, you'll need to contact the Social Security Administration to enroll in Medicare. They will not auto-enroll you in this case. Again, it's the Social Security office that you contact regarding enrolling in Medicare, not Medicare itself. It's important to keep in mind that Medicare has timelines and rules for enrollment. If you miss these deadlines, you could face fees and penalties that you have to pay for the rest of your life. I know that sounds harsh. Medicare set this up to motivate beneficiaries not to delay enrollment, which would drive costs up for everyone. Both Medicare Part B and Part D are subject to late enrollment penalties. If you continue to work past age 65, you will not be subject to these late penalties as long as you maintain full medical and prescription coverage with your employer. Let's take a look at your enrollment timeline for when you're turning 65 and leaving work. 6 months before you turn 65, you should start familiarizing yourself with Medicare. Take the time to learn the different parts of Medicare. Research Medicare costs and how to get help with costs. You may qualify for low-income subsidies. Many people are surprised to find they qualify for help, especially with Part D prescription costs. So review the income limits for this. Now, 4 months before you turn 65, start considering your personal options. You also want to determine whether you have any retirement health care benefits and how those might interact with your Medicare. 3 months before you turn 65, you become eligible to enroll in Medicare, which will become effective on the first day of your birth month. Once you sign up for Medicare Part A and Part B, you also can enroll in a Medigap plan or a Medicare Advantage plan. Medigap and Medicare Advantage plans require a separate enrollment process. You will not be automatically enrolled in these plans, even if you're taking Social Security. This is a great time to meet with a Medicare expert like Advise to get an unbiased comparison of all the plans available to you. If you've completed the enrollment process, your Medicare coverage will begin on the first of the month you turn 65. Now, you're still eligible to enroll for another 3 months, but it's definitely not advisable to wait. If you wait to initiate your enrollment in Medicare, that can delay your effective date, which in turn then can delay the effective date of your Medicare Advantage or Medigap plan. If you miss the last 3-month time period, you'll have to wait months or even a year later to enroll and will incur penalties. If you're staying on at work, you don't have to worry. Now, let's talk about what happens if you plan on working past age 65. The first thing you want to do is meet with your employer group benefits specialist or human resources department to see if your employer plan works with Medicare. Now, in most cases, it's a choice between continuing your employer coverage or dropping your employer coverage to elect Medicare. If you choose to keep your employer coverage instead of taking Medicare and you're taking Social Security, you'll need to contact Social Security to delay your Part B enrollment. You can go ahead and let Part A begin if it's premium free for you. If you're not taking Social Security, Medicare will not begin until you request it. It's very important to stay aware of the timeframes to enroll in Medicare once you do choose to leave your employer plan. Here's the timeline for Medicare if you are staying at work past age 65. 6 months before is when you should start familiarizing yourself with Medicare. Be sure to set up that meeting we talked about with your employer benefits specialist to see if your employer plan works with Medicare or if Medicare is something you should consider taking now. 4 months before is when you should look at all the options available to you. We recommend reviewing your employer plan information with a Medicare expert so you can see exactly how it compares to Medicare. Now, 3 months before you turn 65, you can start the enrollment process if you've decided Medicare is your best option. Your plan would then become effective the month you turn 65. Now, you have another 3 months to decide to enroll in Medicare. After that, you can't enroll until you leave your employer plan without paying penalties. If you decide to stay with your employer plan for now, take note of what you need to do and when you need to do it once you decide to retire. You have 8 months to sign up for Part B without a penalty once your employer coverage ends. But ideally, you had everything in place so your Medicare coverage will begin the day after you retire. The Medicare experts at Advise can help make sure you meet all your deadlines and enroll in the right plan for you. At Advise, the patient is at the center of everything we do. We partner with physicians, pharmacies, and payers to provide concierge-level service to their patients and customers. In other words, we aren't working for a specific insurance company. We're working with your doctor for you. And our services are always free to you. Our goal is to simplify the Medicare experience. In addition to providing side-by-side plan comparisons, we can answer questions about your Medicare benefits, including prescription costs, and help you understand your billing statements. And of course, we offer educational seminars on Medicare like the one you're watching today. I hope this seminar has been helpful to you in terms of understanding both how Medicare works and what steps you need to take and when to enroll. In the following days, we'll send you an email asking if you'd like to meet with one of our advisors. I encourage you to reply and schedule a no-cost, no-obligation, personalized consultation to ensure your transition to Medicare goes smoothly. You're also welcome to contact us with questions at any time through our website, adviseinsurance.com. Thank you for joining us, and I hope you have a great rest of your day.